The Arizona Board of Pharmacy aims to keep controlled substances from getting into the wrong hands. But as Karla Liriano reports, one of their methods is raising privacy concerns.
The board has rolled out new monitoring programs in recent years to keep pills out of the hands of addicts. But it also has an alert system to send out details on fraud attempts at pharmacies. Anyone can sign up for these alerts on the board's website. Teresa Sickler owns and runs Melrose Pharmacy in Phoenix. She uses the State Pharmacy Board's Controlled Substance Prescription Monitoring Program to curb prescription fraud.
When a patient comes into the pharmacy, especially somebody we haven't seen before, we'll check their history. So we'll be able to see if they've gone to other pharmacies, if they're, like how recent was the last controlled substance prescription they got.
She says using the database is an important part of her job. However, she doesn't like what comes next. The alerts can include full names, addresses, phone numbers, and physical descriptions of those suspected of prescription fraud.
There is no regulatory process around a fraud alert. It is just it's a communication tool that we use, and a pharmacist has to use their judgment call to utilize that information we send to them. That's all it is, really.
While that brings up privacy concerns, the board says it's an essential part of the system.
We do have to have identifiable marks. So if there's a Miss Jones going around or Mr. Jones going around passing fraudulent prescriptions, there's a lot of Mr. Joneses out there. So if we can't connect the dots and we can't identify that that's the person, then the fraud alert won't serve any purpose.
They even used to have social security numbers, but the pharmacy board removed those last fall after an interview for Cronkite News investigation into opioid abuse in the state.
A lot of times these fraud alerts come through and then they go out without proper vetting. It came to our attention that this was an issue, and as soon as we were notified of it, we took action and took out that information.
Stickler's afraid that detailing those incidents will result in more prescription fraud attempts.
It definitely does make me nervous knowing that other people can look into the system. Some of that information should not be out in the public.
And what would convince her to start using the fraud alert system?
I would definitely take patient-sensitive data out of it, or be specific on who can sign up.
For more information on fighting fraud at the pharmacy and opioid abuse in Arizona, check out our full investigation at hookedrx.com. In the broadcast center, Karla Liriano, Cronkite News.